we're here today to help the people in the area work out what they want from primary care in the future. So to facilitate the session, not to give you any answers, but to help come up with your solutions to the problems in the area.
I just want to emphasise really that the CCG's got a real commitment to work in a dialogue way with primary care around helping us co-create the primary care strategy. I think the role of the CCG is to be really clear about setting what the non-negotiables are. Some of those might be around taking a population health approach, around being really focused around outcomes, and a real commitment really to do this collaboratively between now and Christmas. I think it's very important when we talk about primary care that we also talk about urgent care, and it's difficult to do that in isolation. We have got some national, some regional and some local drivers in relation to that. Some of the challenges we'll have to face together is around how we move towards 7-day working. We'd also need to be working closely with our partners across the TST work programme, but there's a real commitment to think about how we integrate a single point of access around urgent care to bring together 111, GP out of hours and the urgent care system.
It's great to be here today because what we're trying to do is make sure that everyone who's here has a say in the development and the planning of the future for primary care in Tower Hamlets. That's not primary care maybe as we know it in general practice, but it's a whole population approach to primary care which brings in everyone who's involved in dealing with the health and social care of the population. This is really important. It's really important for patients and it's really important for the sustainability of general practice in Tower Hamlets. And it's only by utilising the opportunities that we have with the Prime Minister's Challenge Fund, the Vanguard and other close links with integrator function with our partners in THIP that we'll be able to deliver and able to carry on with primary care as we know it in Tower Hamlets. So I'd encourage you to make sure that you feel at the end of the day that your voice is heard. We really need to make sure that you will be part of the solution and certainly part of the planning process as we move forward with this incredibly important project, the Prime Minister's Challenge.
I'm working on the cycle of demand, which really interests me because I think we're under a lot of pressure in primary care at the minute. I've just met with a Northwest group who were fantastic. We looked at what things cause demand on our time, what current solutions we've got around, and what we might do if we kind of got endless capacity or blue sky thinking. And they came up with this list, although there's a massive list sitting behind that of lots of ideas. So we just put the highlights on this sheet of paper. The main things that cause pressure on us are kind of patient expectations, system failures, intensity of work, trying to cram a lot in one appointment. There are solutions currently that MDT meetings, patient engagement, personal lists, non-medical solutions, sending people to social events. So systems cooperating, more workforce and planning ahead with a stable economy for general practice. So that's where we are.
My session was evaluation. So in terms of evaluation, I think the biggest bit of feedback we got from people today is that we need much more accurate data. We need to be able to link data sets up across the piece, so making sure that we're able to link in out of hours and walk-in centre with the current linked data around GP and A&E. And we particular emphasis on things like patient satisfaction and staff satisfaction. Lots of feedback about the National Patient Satisfaction Survey isn't going to be sensitive enough, and we need to probably do something locally, much more qualitative evaluation of whether people are finding these services useful or not.
Well, this is about developing an IT strategy for the Prime Minister's Challenge Fund. And we're building on a very strong foundation. And the foundation consists of 3 planks. It consists of single systems. So in the hospitals across the patch, we have the Cerner system, which is a single system. In general practice, we have a single system of EMIS Web. And in social services, we have a single system as well. So it's providing interoperability for those 3 systems. And the second strand is to do with big data. So At Queen Mary, which is our local university, we are able to collate all the data on all the 300,000 patients in Tower Hamlets and produce hard outcome data on what we're achieving by reforming and changing the care pathways that our patients are going through. In terms of these out-of-hours hubs to provide extended access, we can use that same platform of our single GP system to provide access to the full GP record for patients seen in the out-of-hours hubs, as well as having innovative ways of patients being able to have online access to advice, to fill in online questionnaires about health problems such as their hay fever or their cough, and getting a response, within 24-hour response onto their smartphones from their GPs. And a combination of increasing the interoperability of IT to all healthcare professionals, so whether we're looking at a single record for the patient across the health and social care patch, and also giving patients much more access to their doctors and their nurses and to their own record across the new channels of communication on their smartphones and their computers at home. We hope to transform care pathways and the patient experience for patients in Tower Hamlets.
I was really impressed with the turnout and the participation. Everyone had great ideas about how we could deliver this, particularly around potential for more nurse involvement, more HCA involvement, although that comes with challenges around recruiting. I was also impressed with the ideas about how GPs are going to contribute around the discussion around routine and same-day appointments. We're going to have to try and work with GP practices and each individual hub about how we deliver that.
I thought this was an excellent event, really well attended. It gives us an opportunity to think how we can improve the provision of services for patients, and we need to move slowly and evaluate what we are doing so that we can identify any areas that are not working very well and adapt the system as needed. And while we are evaluating it, we need to not only think of what outcomes are important to us as commissioners or providers, but also what outcomes are really important for patients. Because at the end of the day, this is about improving care for patients and changing the way things are delivered for them.
We just had a session thinking about the Prime Minister's Challenge Fund. Amazing turnout, and I think some concerns about what we're being asked to do, but the thing that was definitely, everyone was really keen on trying to work together to cope with the overwhelming demand that we all face, and that actually there were real gains from working collectively, for example, on systems and processes and sharing good practice. I mean, it was fantastic having an opportunity to talk to some of the other teams. I think we're a bit nervous about the hub model, not sure who is going to actually staff them, but you know, willing to have a go and test some of these ideas together.
So it's been a very exhausting afternoon, a very hot afternoon. We never in a million years expected to get the kind of numbers of people. I think we had about 150 people attend. I just want to thank everybody for coming, taking part, taking active part. We've got a vast amount of material that we're going to go and try and make some sense of in order to put the programme back together in a way in which makes sense for people locally.